from the Pediatrics and Neonatology journal. So you can follow this. So see, first 60 minutes is very important. So you start delivery room CPAP and verify pressure transmission by hearing the bubbles, by seeing the bubbles, ensure that the prongs are adequately paced. And again, RAMS cannula has definitely revolutionized care of CPAP. We use RAMS in the labor room, we use RAMS during transport, and we use RAMS in the NICU also. And for extremely small babies, if you are not able to deliver pressure with RAMS, you can use the mask, but RAMS is simple to use and easy to titrate pressures and oxygen. So connect the pulse ox to the right hand within 1 to 5 minutes and insert an umbilical line within the first 30 minutes and test the sugars. At admission, you should check the temperature and sugars, and because that should be stabilized as early as possible, and give surfactant within the first half an hour if possible before the lung fluid disappears, and start the baby on aminovin. The first fluid should be amino acid, because the earlier you start amino acid, better will be the anabolism, better will be the weight gain, and better will be the outcomes of this baby. And again, the moment you start the line, you can give a caffeine bolus and start aminovin. Other drugs or sedations are scheduled later. We do not use sedation routinely, and we do not use antacids routinely. So place the transcutaneous blood catheter or the pulse oximeter, and next step, within 30 minutes or within 1 hour, try to get mother's own milk. The earlier you give the drop of colostrum to the baby, just coat the mouth of the baby with colostrum, you will be able to colonize the baby's mouth and baby's gut with the mother's flora and mother's gut, mother's microbiota, so that the babies can be salvaged from all the infections. Then came the lung ultrasound. Within the first 3 hours, you can do a lung ultrasound to predict the subsequent need for ventilation and surfactant need also. So this is what we are doing in our NICUs also. We have gone for more often than lung ultrasound than X-rays for making diagnosis of RDS and also for seeing for severity of RDS. So within the first hour, start CPAP, temperature management, sugar management, umbilical line, aminovin, caffeine, surfactant, and then mother's own milk. Coat the mother's milk on the baby's mouth, and within the first 1 hour, if you give mother's own milk and ask the mother to pump as frequently as possible in the first few days, your baby's outcome are going to be dramatic. So I feel the 3 major interventions which have improved the outcomes of premature babies are steroids, CPAP, and mother's own milk.